What are some of the challenges that doctors can face? How have you started to develop the skills to manage this?
Okay, so having observed doctors in a hospital and GP setting as a part of my work experience, I came to appreciate that even though the roles are very different, many doctors actually face the same issues, and most of these stem from stress. So, stress due to the immense workload can lead to burnout and can lead to a lack of motivation in the job. And then that ultimately down the line has an impact sometimes on patient safety. So, in terms of how I have started to deal with stress, I find that it's very helpful to shift my focus away from whatever that's stressing me out. So, I like to do this through yoga. I think that taking care of my physical and my mental health puts me in a better place when I come back to actually dealing with the thing that is making me stressed. I also like to channel my energy away from academic work, if that is something that's making me feel stressed, into something creative. So I enjoy making art, and I make sure to take some time to do that. In terms of managing the academic workload, which I came to appreciate was an issue with doctors when they had to be on wards but also study for exams for specialist training, a way to sort of manage that I think I would use would be to stick to a timetable. So this is something that I do at the moment. So plan ahead and allocate time to do certain things. And that has helped me kind of put everything into place and not feel so stressed anymore. Overall, I think to manage stress, I place a really important emphasis on my physical and mental well-being.
A good example was used and elaborated well on, and it was actually decently well reflected on as well. The student used our three E's that we talked about earlier, which were evidence, elaborate, and evaluate. So on the reflection front, there was a decent amount of reflection.